A stye is a very common condition that affects many people. It is also known as a hordeolum. Styes are red, swollen lumps that form along the edge of the eyelid, close to the lashes. Sometimes, a stye can occur inside or under the eyelid. Usually, styes are a minor annoyance and only need treatment at home. There are some situations where it is important to consult a doctor, however. Read on for more information about ways to manage a stye and preventing them in the future. Types of styes. There are two types of styes, depending on where they are located. External, when the stye is located at the base of an eyelash follicle. Internal, when a stye is found in the oil glands inside or under the eyelid. A chalazion is very similar to a stye. They occur when an oil gland inside the eyelid becomes clogged with oil. Without treatment, an internal stye can turn into a chalazion. It can be difficult to tell the difference between a chalazion and a stye. Chalaza tend to occur further away from the eyelash line than a stye. In addition, chalaza usually don't cause any discomfort. Causes. Styes are caused by a bacterial infection of the eyelash follicle. There are small oil glands that sit around the eyelid and drain through ducts into the eyelashes. If objects clog the duct, the oil can't drain and backs up into the glands. The gland becomes swollen, causing the stye. Risk factors. Anyone can develop a stye in their eye, but there are certain factors that can increase the risk of developing styes. Someone who has had a stye or chalaza in the past is more likely to get another one in the future. Certain skin conditions, like rosacea or dermatitis, can make a person more likely to get a stye. Other medical issues, like diabetes, swelling of the eyelid, and high serum lipids can have the same effect. Using old makeup or not completely removing eye makeup on a regular basis can also increase the risk. Home treatment for styes. Most styes can be treated at home easily. There are over-the-counter ointments that can be used. The most effective treatment tends to be a simple warm compress, however. Someone with a stye should soak a clean washcloth in warm water and apply to the affected area for up to 15 minutes. This should be done a few times each day until the stye is gone. If the washcloth cools off, more warm water can be added. It is important to avoid intentionally popping the stye. This can cause the infection to spread to the rest of the eyelid. If the stye opens on its own, people should massage the area around the opening to help drain the infected fluid. This discharge may be white or yellow, similar to pus. Avoid wearing makeup or contact lenses until the stye has completely healed. Medical treatment for styes. Doctors may prescribe an antibiotic ointment if the stye becomes infected or does not improve with home treatment. The doctor may also give a steroid injection to reduce swelling or inflammation in the stye or chalazion. If these treatments don't work or the stye starts to affect the vision, surgical removal may be needed. For this procedure, the doctor will inject numbing medicine around the affected area. They will then make a little opening in the stye to drain the infected fluid. The doctor who would carry out surgery on a stye will usually be an ophthalmologist, or eye doctor. Preventing styes. There are some easy ways to prevent getting a stye. People should completely wash makeup off the face and eye area every night so that it doesn't clog the follicles around the eyes. People should be sure to replace old makeup around every 6 months to prevent bacterial growth and infection. Avoiding sharing makeup with other people can also prevent getting an infection from someone else. A person who uses contact lenses should ensure good hand hygiene when taking out, putting in, and caring for their lenses. In addition, avoiding touching the eye area can also prevent spreading bacteria to the skin around the eyes. Symptoms of a stye. Styes usually only happen in one eye at a time, though it is possible for both eyes to have a stye. Early symptoms of a stye are generally mild and may include slight discomfort or redness along the lash line. The affected eye may also feel irritated. As the stye develops, other symptoms may include a red bump that resembles a pimple along the eyelid that is close to the eyelashes, a small yellow spot in the middle of the bump, feeling as though something is in the eye, light sensitivity, eye discharge or crustiness along the eyelid, excessive tear production. A chalazion produces similar symptoms, but the lump is hard and painless. When to see a doctor. If the stye doesn't go away within a few days of applying warm compresses or keeps recurring despite treatment, people are recommended to see a doctor. Other signs that it is time to see a doctor include if the stye gets worse very quickly, it is bleeding, it starts to affect vision, the stye spreads to the white of the eye, there is redness in the cheeks or other parts of the face. Outlook. Styes usually go away on their own within a few days up to a week. A chalazion may last a little longer, sometimes for up to a month or longer. Though rare, recurrent styes in the same location can sometimes indicate a more serious problem. In this case, a doctor may perform a biopsy to rule out other conditions. Stye treatment number 1, keep your eyelids clean. The first thing you should do if you develop a stye is cleanse your eyelids. You can use diluted tear-free baby shampoo on a cotton ball, washcloth, or makeup remover pad. Then rinse your eyelids with warm water and gently pat them dry. Also, be sure to wash your hands before and after touching the stye, and don't share your towels or washcloths with others. Pre-moistened eyelid cleansing pads are another option. You can find these non-prescription items in most drugstores. It's wise to stop wearing eye makeup temporarily when you have a stye, because covering up a stye can delay the healing process. Also, discard old makeup or applicators that could be contaminated. And if you need vision correction, wear glasses rather than contact lenses until your stye heals. Stye treatment number 2, apply warm, moist compresses. You can encourage a stye to heal faster by applying warm compresses for 10 to 15 minutes, 3 or 4 times a day. Some people use tea bags for this purpose, but a basic clean washcloth dipped in warm, not hot, water will do the trick and is easy to prepare. Wring the cloth so it's not dripping, then place it over your closed eyes. The goal of this therapy is to bring the stye to a head, like you see on a pimple. But whatever you do, don't get anxious and try to pop a stye. The warmth from the compress often will allow the stye to open, Drain and heal on its own without causing trauma to the eyelid or possibly spreading an infection by squeezing it.